Can you hear me now?
GM.
GM. I can hear you. Nice. Can hear you. Okay. Good.
Have we started yet? Or not yet? One question. Okay. All right, then we can roll. Okay. Hey everyone. Nice to meet you all virtually over the live stream. We're really excited to walk through BIOS, which is our new AI scientist that we have launched. This is something that we've been working towards for quite some time now, and we are really excited to just share the outputs and see what everybody can come up with it. Before I share my screen, let me just make sure everything is okay. Can I get a thumbs up in the chat? Amazing. Okay, I'll just give a quick intro of myself and then I'll hand it off to others as well. I'm Akash. I'm the head of AI at BioProtocol. You hear some screaming in the background. That's my babies, so apologies. Paul, I'll hand it over to you.
Hi, everyone. I'm founder and CEO at BioProtocol. Don't have a baby screaming in the background, but it's next door.
Chiara, you want to go next?
Hello, everyone. I am Chiara. I am one of the scientists at Bio, and I pass it on to Lucas.
I want Lucas, also one of the scientists of the team, handing it over to Mihailo.
Hello, everyone. I'm Mihailo. I'm working as an AI engineer. So I was building the BIOS. That's it. Akash.
Thanks, everyone. Paul, maybe I'll hand it off to you to give some quick starting intro, how you sort of see the AI efforts having evolved throughout the last several months, and then I can do more specifically talking about some of our research and leading into BIOS itself.
Yeah, of course. So one of our previous co-founders at Bio is someone called Vincent Weiser. So he previously co-founded Prime Intellect and actually he co-organized Zuzalu, which I think happened in mid-2022. And they invited some really prominent speakers. One of them was actually the founder of Skype, who then later on led Anthropic's funding round. And so very early on, kind of infused the DeSci ecosystem and a lot of our thinking at Bio with kind of being AI centric, or like making AI a very prominent kind of infrastructure play as part of our overarching decentralized science stack. And if you've been a part of the DeSci ecosystem for a while, or essentially ever transacted with scientific research or try to fund something, you would know how long it often takes to hear back from universities to work out a fully fundable research proposal, and essentially move science on chain. So like all the way from interacting with the tech transfer office to like negotiating a licensing deal. And the longer we've been working in DeSci, the more we've kind of like realized like, hey, what if we can make scientific discovery kind of native as part of the stack? So on the one side, I think AI agents or AI scientists can be used to essentially guide and almost project manage scientific discovery, essentially help scientists formulate experimental plans. But I think also where it gets extremely exciting and where BIOS and also Aubrey have actually shown to be really good at is actually literature mining and genuine novel scientific, which I think is getting into like a really exciting field. So we began building BIOS AI team just over a year ago, so like in December 2024. And then Akash, I think you joined the team in March, April last year?
May.
May. Okay, we started speaking in April, I think, and have been really accelerating with a lot of rigor since. I think on Ethereum and in crypto in general, around the same time we saw this kind of explosion of on-chain agents and kind of like a fusion of crypto and AI. A lot of that has culminated recently in I think it's ERC 804 release, and then. So I think on the one side, we're seeing that crypto networks are becoming kind of like native infrastructure for agents to play on. And on the other side, what we've seen is a big explosion in scientific infrastructure AI-driven scientific infrastructure. So in probably, I'd say June, July this year, we also began integrating the Future House stack. So Future House offers one of the most kind of advanced state-of-the-art AI scientists today. And they are also the creator of the BigBench benchmarking framework that we've referenced a lot in our post. I'm sure you'll speak to it a little bit more, Akash. And I think around the same time, we set out on the development of Aubrey, which has been kind of like BIOS tokenized longevity agent to date, in a close collaboration with Dr. Aubrey de Grey from Sense Foundation. That has kind of given, so a lot of our AI team was really like focused on that as a first like fundamental development piece. Aubrey, in its kind of lifetime, especially kind of during that big adoption phase we had in I think in September, October last year, generated over 3,000 novel scientific hypotheses from user interactions on X. All of those were ledgered on chain, and I think it kind of paved the way for us to begin, like for us to get real user interaction. Like if a lot of scientists or users in X were starting to interface with these systems, like what does that mean? And then I also know, Akash, that you spoke a lot around that time around how we were using Future House, and some of the API integrations that we had were reaching its limits. And I think it was around that time that you and AI team decided to embark on our kind of own, like to expand our own infrastructure away from just kind of a couple of knitted together pieces and frameworks into actually developing our own standalone framework. And then Akash and team published a really great paper that led into kind of the deep research framework that I think you guys put live in December. And then maybe, I think you started pinging me in mid-December around that we were achieving really amazing benchmark results with that framework. And that's taken us to yesterday's, I think, seminal release of BIOS, which I think to date is like beats all of the state-of-the-art benchmarks, and is also like fairly accessible and open to use, kind of for scientists to play around with. And our hope is really that over the next couple of weeks and months, we're building this out into like a fully integrated stack where scientists can engage BIOS to come up with novel scientific discoveries, or even spin up their own specialized agents, and then essentially create projects from that with like full experimental design roadmaps, and launch those projects on BIO protocol in order to fundraise for their scientific research. But yeah, that was a long intro. Just want to start off again also by saying super grateful to all of our supporters, our token holders, all of the individual token holders and scientists that are working in the various projects. Huge milestone, I think, achieved yesterday, and so much amazing work coming. So, Akash, I'll hand it back to you.
Appreciate the landscape view, Paul. I will go ahead and share my screen. Give me 1 second. Can everyone see my screen? So this is the paper that we've preprint that we have published on Archive, Rethinking the AI Scientist, Interactive Multi-Agent Workflows for Scientific Discovery. As Paul mentioned, we have essentially rethought from first principles how to essentially maximize the intelligence of scientific agents at the framework level. I won't go into like all of the nitty-gritty details because I want to make the showcase about BIOS and what you can do with it. But it's useful just to think through like the architecture of what we have built. Essentially, our open source repo, called BioAgents, you can think of it as like an orchestration layer where these different sub-agents can work together, combined in customized workflows such as deep research to enrich or enhance the quality of scientific outputs. And by potentially launching additional sub-agents, whether they're for specific knowledge domains, such as Ombre for longevity, or specific use cases, such as like customized computational biology models, you can quickly see how the overall AI scientist gets more and more competent and more capable. And the great thing about AI is these things can scale quite a bit. So I really believe that we are approaching the era of scientific abundance in terms of what ideas can be pursued, and then hopefully fundraised as well. Just a little bit more about our architecture, and then I'll just highlight a couple other points about this paper. The big thing is that at the orchestration level, there's a persistent world state that informs how sub-agents sort of work together in order to solve a problem or best respond to the user's research query. And in this paper, we touch on how our literature agents specifically and our data analysis agents are actually doing it at the sub-agent level themselves. So if anybody's interested in the sort of more like software engineering details, this is definitely the place to look. Right now, our literature and data analysis agents are not open source. It's the orchestration layer itself, but we're looking to see at some point if we can open source that or provide ready API access to these agents, not just interacting with them on BIOS. One other thing I would like to highlight are the benchmark results. So we talk about BIOS. BIOS is like the overall AI scientist, but we've been trying to figure out how we can measure capabilities at each component level. And I think this is where Future House has really shown the way. They've paved the way. If you look at their development history, they have been building sub-agents that are responsible for different elements of the scientific research process. For example, now that they have Edison Scientific that they have spun out, Edison Data Analysis is really like responsible for the more bioinformatics or analytical aspects of user queries. So Bixbench is a really good benchmark that they have published for this specific topic. It's the type of benchmark that is complicated because it's open-ended, and it's really something that you cannot use like memorization. You can't use like typical AI RAG to necessarily solve. There is critical problem solving involved. So Bixbench also has 3 different evaluation modes. One of them is open answer, and then the other 2 are multiple choice questions with refusal and without refusal. The agent can choose to refuse to answer a question if it feels like it doesn't have enough information. So yeah, I think what we have found is that based off of everything that's publicly available, the BioAgent deep research framework, the BIOS AI scientist, is performing at state-of-the-art level on every single evaluation mode, which we're obviously very excited about. And Mihailo is on this call, and if anyone has any questions afterwards, I'm sure he'll be willing to kind of address them. One final point, just as I wrap up and then prepare to hand it off to Lucas, we really cared about the the proof. A lot of projects will claim, hey, we have frontier state-of-the-art results, And so we've added into the appendix of this preprint, like this specific answers on the benchmark. So anybody can actually verify what it was that the agent outputted, where it got it right, where it didn't get it right. And yeah, this is just available for anyone on the appendix for the preprint. Feel free to check it out. And we're also looking at more detailed interactive visualizations too, so that you can really track the reasoning trajectories for each individual question. This is something that I think will give like as much we're trying to give as much visibility as we can to show that these results are in fact concrete. Okay, I think that's all that I had planned. Lucas, I would love to hand it off to you to just give an overview of BIOS from the perspective of a potential user, like a scientist or a researcher.
Let's do it. Let me share my screen. I hope you can see my screen.
Yep.
Yeah, it works. Okay, thank you. So this is what you will see when you check out BIOS. Maybe someone could share the link to BIOS again in the chat. And first of all, like this is your landing page. I think everyone who is using, I don't know, Claude or ChatGPT, you will be familiar with something that looks like that. And this is actually, I think, already features quite a lot of information and that we're going to go through one by one, basically. Whenever you have a question, please feel free to just shoot it. I'm happy to answer on the go. So what you'll see here, you're able to describe your prompt. I think this is rather traditional, normal in Chrome LLM times. Here is something quite interesting. You can upload up until 2 GB, which is, I think, very good because if you're a scientist, most of the data should be within this limit. If you have bigger limits, we're always exploring that. But one key note here is that you do not need to upload all your data from basically your laptop or whatever, because you can also tell the agent with an URL to basically download data from a link directly. So this is maybe the more convenient way if you want to replicate results or if you want to really just if you don't want to download and re-upload some of the data. Here you can switch between deep research and chat. Deep research is, let's say, default.
Lucas, I don't mean to interrupt. Would you mind being able to zoom in? I think some of the audience can't see fully.
Yeah, let me try to. Like this?
That's a lot better, yeah.
Okay, nice, thank you. Yes, so here deep is a deep research. That is the default. And I think it's also worth for everyone checking out BIOS to actually use that mode. And here you see your credits. Of course, I have quite a few ones because I'm actively testing. But here, this is a really interesting piece that you should definitely check out. So we have different features built into the deep research mode. One is steering, where you're basically interacting with the system as a co-scientist. I'll show you an example in a minute. You have smart. As you see on the credits, it also shows you how often it will basically, how many iterations it will make. So for example, here, it will stop after one prompt, and then you can basically re-interact with the agent to basically steer it in one direction. With smart, it runs up to 5 minutes, 5 iterations, 60 minutes roughly, assuming that one run is roughly about 20 minutes. And here with the autonomous mode, which is actually my favorite now, it will run up to 8 hours or 20 iterations. So this is the overview. You can also use projects. So if you are using it heavily, and if you're, for example, exploring one data set with many different angles or whatever, you would definitely, I would strongly advise to create a project folder and list all the projects. As you see here on the left, I have some project folders. And I think everyone who uses it more commonly definitely creates these projects, which is something should be also quite, I guess, you should be familiar with when you're using traditional LLMs. You can definitely pick some of the examples. I would advise to just go for whatever is interesting to you. And here on the left side, when you click New Research, you will actually land on this page. You can search chats. I think this is also a common feature. Shared chats is you have the ability, I briefly click on that, you have the ability to share some of your research runs with others to check out. And I think this is actually quite interesting, so others can follow along if you make a cool discovery and want to share maybe within your lab, maybe within your team, maybe on Discord, whatever, you're free to share everywhere. And here you can see how many of those you have basically shared and are publicly available. In your research center, this is actually one of my most favorite features. You can actually see how many of your runs are actually still running, how many do you have in total, how many completed. You can filter, you can definitely see what is currently still running, how many, at which step it is. So this is really cool. This is my main interface when I'm using BIOS. This is something that you will also see, or you can also check out. Whenever basically you have at least 3 iterations, you're able to create, let's say, a paper. And this paper is more like a research report. So it basically summarizes the conversation that you had so far whenever you click on the button. And it is a very good summary, quite lengthy, of everything that is in there. So here you can see how many of those you created, and basically access those or re-download. So now, that is the overview. Any question on the UI before I basically go into some of the examples? Assuming that's a no. Good. I created, or I did some runs today and created these demo runs, basically. And I want to first start off with, let's start with this one. So what you see here is basically a prompt that I used in the steering mode. So remember, when you're doing steering, it only does one iteration and then it stops. And this is a research query that was, or basically prompt that was derived actually from a longevity question. So let me briefly switch tabs. So it actually was derived by a post. I hope it works. By a post from Brian Johnson. So basically, if you're into longevity, the idea was, okay, resting heart rate is a single most important health marker that he tracks. And from that, we thought, okay, hey, what would be cool to explore basically, use BIOS to explore whether we can build a supplement, or what would it take to build a supplement to lower your resting heart rate. And this is why I came up with this research prompt. And I started this, actually 20 minutes or so. And as you see here, I would say, medium level specific. So I still said, okay, please use randomized trials, meta-analysis, because we want to have high scientific rigor. We want scientific evidence-based responses. We don't want to, let's say, have any assumptions, let's say. And we want to know, okay, what is the typical BPM change? What is the typical dosing? How long would you need to take it before it actually makes a difference? Contraindication, safety issues, all stuff like that. So I came up with that. And you can find prompt best practices on our documentation page. In general, I think if you're more specific, you get better results, especially if you use the autonomous mode. I would highly recommend using something like this, or roughly something like this, to get good results. And the quite interesting part, I will not go into detail, but it will be interesting for you to see. So it was basically one first iteration. And it already came up with, for example, omega-3 fatty acids, often, and here you will see, I'll just basically go fast forward on this one. You have magnesium, that would be interesting to see, coenzyme Q10, potassium, taurine, yeah, many different things to check out. And remember, as we have only one iteration done, you can now basically pick some of your suggested steps. So here you're really in the driver's seat. It suggests stuff, but you basically say, okay, listen, I want to go into this direction. I want to check this out. So as and a funny fact here is during like the initial development, I honestly we only had like this iteration mode, and to be honest, I agreed, or I was happy with the proposals and literally every single time. So this is why I just said, yeah, go on, or clicked on something. So for me, to be honest, I'm so pleased with the autonomous mode. It's so good. And I'll show you why. If you, let's use this one. So let's start here at the top. So for example, here you could see if your query or your iterations or conversations, however you would call them, are still running. Here everything is complete, 5 runs. And here, if you click on it, you can see and click through each of the steps and what was basically done and the state during each of the steps. And now switching back to the very first step when we started. So as you see here, this is the exact same prompt that I use with the steering mode. And what is really interesting, in my opinion at least, you can see that we came to roughly the same status, let's say, during this run. We do have coenzyme Q10, we have taurine, we have hawthorne. I think you remember some of them, omega-3, magnesium. So it's quite interesting that you are roughly at the same state. And this is basically the idea of, okay, what could I focus on next? So these are actually outlining, okay, next iteration, the agent, because we are now in the autonomous mode, will focus on exploring coenzyme Q10, taurine, based on the very initial literature research or the very initial step. Now we're fast forwarding to step 5. Still, you can see here, it's the very same prompt that I initially gave in. And it very interesting, in my opinion, also is that it still stopped after 5 iterations, even though it could have gone to up to 20. So it always does this if something, if we reach a point where I think the evidence is quite good and it's kind of decided, okay, hey, this is kind of answering, or it's already answering the initial prompt, maybe it's better to stop and then check with the user what to do. So it does not necessarily run these 20 iterations. It stops whenever there is some significance or results that are worth discussing with you as a scientist. So, and here, actually, I think this is now really interesting. You do have some, or it found some interesting information about, for example, taurine supplementation. And some things, because they will get important. You do have, for example, some already some gram per day. You have some numbers for BPM. You have coenzyme Q10. You have omega-3 fatty acids. So roughly similar to the very first iteration, that was step 1. And now we are scrolling down. I think here it's actually really cool because as you remember, sorry for scrolling through. As you remember, I also said, okay, I want drug interactions, I want contraindications, I want safety issues, all of this. So it is now also important to see that it actually adhered to my initial prompt, because here you now get exactly this. So you get, okay, hey, I found 1.5 to 3 gram per day. this is what I also requested, how many BPM on average, how long do I need to take it before, for example, an effect comes in? What are the key interactions? Is it safe to use? And here you also see, okay, I have omega-3 224 gram per day, same key, and not the same key interaction than taurine, but same style. You do have everything that you need, magnesium, or hopefully a lot that you need to explore a supplement or what you would take to lower your resting heart rate. And it's actually very interesting also that you do have like these, everyone who's taking magnesium, I think knows what are some of the safety profiles or key interactions are, because yeah, I think it's one of the most common supplements. And it has a tiered approach. So for example, as you remember, we had beetroot juice at the very early beginning, we had hawthorn, but it's okay. Maybe it's indirect or there is no, let's say, hard facts on that, or very indirect. So it's not tier 1. So you could take it, but it might not have like the real effect, or the scientific evidence is not strong enough to actually support that. And very interestingly, he actually came up with a very good formulation that you could now test, but or take. And I think the important part here is that when you think about not only the science behind it, but rather how you can translate science into practice or actually real life impact, now you actually have some scientific idea of what to take for your resting heart rate reduction. Sorry, I'm going to need some water. Yes, so this is, I think, very good because it shows how translational it is. And here, basically, it stopped, but it's asked, okay, do we want me to dive deeper? Do we want to explore a combination therapy further? Should we discuss anything? Maybe clinical trial setup? How much would it cost? Now, basically, you can just, based on everything that was shown, ask a question, and then you would take it down further, explore more. And I think this is really, really strong. So now what I wanted to show you, which is also very cool, is, as I mentioned, this is now the third run that I will show you. And I don't think, like, maybe it's good to show. Again, also, I started this run with the very same prompt. And as you see here, I think you will now remember some of the things I already said: beetroot, magnesium, hawthorn, taurine, omega-3. And if you go to step 6, so it actually did one more iteration and stopped there. So I think this is also a very good signal that it roughly ended at the same time, showing, okay, hey, there is something. Because as you know, it's not, if you're more into LLMs, it's, I think, given, like, determinism isn't necessarily given. It's kind of like, if you think about how probabilistic these LLMs are, so it's actually very good, or it brings more, let's say, at least for me, it's highly confident if you can arrive at the same endpoints given the same input, or roughly the same output, because there is some variance, which is not necessarily related to BIOS, but rather to LLMs in general and how currently the state of the art actually is. But I think going down further to see something quite familiar, and I think this is also very strong because you see a roughly similar structure. So, for example, you do have taurine here, actually quite interesting. It suggests 1.5 to 6 because these were the doses that were used in the trials, but most of them used 3 grams. So this was also what was recommended in the first run. And you have the same effect size, you have time to effect. It's a slight variance. Also in, for example, here, tier 1 is taurine, and actually omega-3 fatty acids. And interesting here is magnesium is only T2. So there is some variance in what literature or how the evidence was basically evaluated and said to, okay, I'll include it. But it's in a level where I would say it's very confident, or I would be confident to at least explore this route further. be it for example, some, I don't know, supplement formulation, or just for some research to explore resting heart rate further. Here, for example, as you see, the recommendation again is 3 grams. You have roughly the same omega-3 dosage, only magnesium is not there. There are also, very interestingly, you also do not have like clinical trials actually testing this. It was the same for the last one as well. So it can check for clinical trials, and then you can see whether it actually was tested or not. And same thing here. You could just go on to say, okay, listen, yeah, I would actually do that. I want to have a personalized protocol. I want to have timing strategies. Like I want to have optimal pharma selection. So this is actually really, really good. And I think such a good starting point. And now, maybe I'll pause here to check whether there are any questions. Any questions?
I don't see any on my end, Lucas.
Okay, good. Then I'll just continue 1 second. So, yes, now you might ask, okay, this is all good, all interesting maybe, but I haven't seen references. Where does all this information come from? Can I trust this information? Whatever. And if you're fast enough, you've probably seen me clicking on this button when we clicked on the on this conversation at the very beginning. And if I open that, so this is basically the thinking modus. You should also recognize something like this if you're familiar with LLMs, and if you're kind of like enjoy watching the LLMs work. I think Claude actually does it really well, where it's, you can follow the stream of consciousness of these LLMs quite well. And we've built something similar. So when you're starting, when we're starting a run, and I will do so to show you, you can see here basically the thinking. So this will, the right side will be there, and you can see, okay, hey, what is this? What is the thinking mode? And only as soon as the thinking and all these steps, the iterations, maybe multiple steps are done, then you receive the left side, which is kind of like the output, the summarized output. But while you're waiting, you might be able to check out what is here. But it also gives you a good or more understanding of why, for example, or how you ended up with the information that you have here. So can you trust it? Why to trust it? So for example, this is, I'll briefly go through, but it's very interesting to see. So this is basically, maybe start with this one. This is, I think, good. From whatever we basically gave in as an initial prompt, and remember, this is at step 6, so it's not originally based on what basically was at the very first beginning. Like, this is not derived solely from my initial prompting, but rather also from the steps and information and like updated state and memory, basically, from the last 5 steps. So if you remember, if you check this out, this is basically the research objective for this one step that was basically the agent asked, okay, hey, listen, I need to investigate taurine before I can actually do, for example, here with the pharmaceutical interaction with SSRIs, to actually give a good and evidence-based answer here on the left side. And now you can see here that a literature review task or research or search task was done. And here you can follow through basically what it did. So what are the publications? You see the DOIs, you can see where it did come from. You can actually see all the information. Basically, what were the methods used to generate this? And I'll just click through. It's just for you to see that actually, like, this is not coming just from whatever, thin air. It's actually backed by literature tests. And same thing here. If we scroll up, here, for example, the objective to derive the left side, so the summarized result for you as a researcher or as a user, it basically was, okay, hey, are there any prior clinical trials? And as you remember, I pointed out that actually we can search for that. And it stated, hey, there were none. But to do so, you cannot just say, okay, there are no. You actually need to check whether there actually was. So this is also what was done here. So here is a literature task. So it was run, and similar to the other one, I won't get too much into detail. So this is basically, I think, a very important piece to remember, that you can also check how we actually arrived at the endpoint for each of the single steps. When you click on this one, it will be open by default, so that you can see the reasoning while you're waiting on the left side. As an overview, you can also go through. I'll just briefly go through, because it's quite interesting that you see here again the very initial research objective that we gave in. As you see here, this is the same. So this is still carried within each step. So we made sure that every single step or iteration really is aimed to solve, let's say, the initial prompt and not something else. We want to have, like, basically the methodology. How can we do that? Like, how could we solve this idea? Is it necessary to do some data analysis or not? Is this actually sufficient to do literature? In this, for example, it is a rather theoretical question. We can do a rather theoretical methodology or the agent decided that, and I think it's actually the right decision. And here you can see some of the key insights derived throughout the steps, and also in this step in particular, that led to then the left side. Here, also some of the discoveries that were made during this process. And we will check out another case study. And in this case study, you will also see the artifacts. So for example, the data that is generated, you can see all of that here. And now I actually prepared another case study with data to show you some of the data analysis agents, but I just want to check in whether there are now any questions.
I just want to add one small point to this. So yes. Obviously, like with the Bixbench results, I'll come back on screen. With the Bixbench results, this is specifically for the data analysis agent. So literature and data analysis are separate agents, and we're continuously working to improve each of them independently. So for example, with the literature, the more sources that we add, the more comprehensive it becomes, the stronger novelty score becomes. Currently, we have the vast majority of open access papers that the literature agent can access. For example, what you would find on PubMed, Archive, bioRxiv, Semantic Scholar. And just by continuing to add to the library of literature the agent can access, it continues to enrich the context. And as for the data analysis agent, which Lucas, I think you can start to share the case studies for this. Yeah, we're really excited about some of these artifacts, because as you'll be able to see with the capabilities that it's demonstrating on the Bixbench evaluation, we really are quite impressed by what it can do just from starting with an idea, starting with a prompt.
Thank you for that. Can you, by the way, still see my screen now? Because I don't.
No, not yet.
Because it tells me I'm still sharing. I'll reshare to make sure. Does it work again?
Yep, we can see now.
Nice. Okay, good. As teasered, second case study that is more data heavy. So now, and we're kind of now entering data analysis properties. So this is also where we are kind of shine, and where I think the Bixbench results are directly related to. And let's start with one of the prompts that I prepared. So I was really interested in inflammatory bowel disease for this example. I think everyone who knows someone with IBD knows how hard or how severe this disease is, how much suffering there is. So it's always very interesting to search maybe for new biomarkers or to search for new, maybe treatment methods. So what I did is use 2 data sets. So these data sets are still on Metabolomics Workbench, are still openly, publicly available. So you can do replicate the very same run. And I just said, okay, listen, you get data from the patients. So you get stool samples and you get serum samples, so blood samples from the same patients. And I want to basically, and just said, hey, can you find something that would be a biomarker to predict when a flare comes up? And the flare is something when the symptoms from morbus Crohn, for example, Crohn's disease, would get more severe. And here, it's actually quite interesting. I intentionally kept the right side open because we will definitely look into this one deeper now. But what is really cool here, I directly uploaded datasets here. I just downloaded them from Metabolomic Workbench, but you could have basically used URLs too. That would have worked too, but for this purpose, I uploaded them. And basically in the very first iteration, you can also already see here in the summary part, the left side, and this is quite interesting. This autonomous run would have run up to 20, but it actually stopped after 2. And to show you why is because already now with these 2 data sets, there was one potential biomarker, hypochloric acid, that showed a hugely significant and concordant. So basically depletion in both, let's say, stool and serum from the original data set that I provided, strong enough for the agent to say, hey, this is an actually really cool finding. And I also did my homework. I found potentially a mechanism. This is something worth stopping and telling the researcher, hey, I found something cool. Please take it. What should we do with it? And interesting here is that you also see key visualizations. We didn't have that on the other runs because we didn't actually came up with data. So these are, for example, correlation heat maps, which I think I won't go into detail, but I think within 2 runs, I think they're really, really good. And you can also see. We'll share these runs so you can check them out in detail. And you can also see how many artifacts the agent actually created. So these are all things you can check out. You can download new CSVs basically you can download the figures, all of this within only 2 iterations. When we now switch to the right side, you do have basically this summary, but this summary is different from basically what I initially queried, because this is now again the idea of what was the iteration for this second step, not for the first step. And again, you can see here, we did some literature. You can see here some well-known PubMed, Taylor Francis. So pretty much like everything you can find on literature, open access. The literature agent will find. Second run with a different objective. Now, this is also a tab that we didn't have in the very first one. It's a data analysis part. So we supply you not only with the results, maybe go to the results first. So you will have the results. For example, these are the data sets that I provided. You still have for example, here a cross matrix. So this is created by the agent with 10 hits. So the most significant hits. It also shows you what was done from a data analysis perspective. So why was it statistically significant? How, in which regard, what was p-value, stuff like that. It will explain you step by step which data sets were used, what was generated from it, all of this. And this is actually, I think, quite good. We're still also quite critical, or maybe not, yeah, to a certain extent self-critical, I think, to a healthy amount that every researcher should be, to say, okay, listen, there might be some caveats to look out. Here, again, summarize the artifacts and the implications and conclusions. These are the figures. And now that you can see, okay, here was actually something done, like here, so this is how we can trust that the agent actually did something. You can see the actual code that was run and created to actually come up with this calculation of, for example, the p-value, of the significance of the analysis of the data set. And you can really, skip through everything, download everything. You can see it, and it actually, I think for me, it's like increases trust on a lot of levels, because I can actually see what was done, what data was used, all of the information that I gave in. So for me, actually, I think this is very cool. And one thing, and then I think we are nearing the hour. One thing that is, I think, there are many things that are really cool, but one particular cool thing is, like, if you think about if we were to, if this holds up, like piperacolic acid would be a flare prediction biomarker that hasn't been ever basically found, because no one has used the same data sets that I had. And there are so many data sets just emptily sitting there because you didn't have like this computational power level and like this sophisticated data analysis power. So in my opinion, it's just worth going out and just trying to see what we can find to potentially help some patients. And as you might already know, I typically run multiple runs with the same prompt. And I did so. No, sorry, this was actually the wrong one. This is actually the one I wanted to show you. So same prompt. You can see here, we're now at step 4 out of 4. We have 2 steps more. And it's actually one of the key things of why it's like this. I'll show you in a second. Interesting here is, again, you can, same thing, you can check out the analysis, you could check out the code, you can check out what was run, you can download everything. Here again, you can download everything. But something interesting, I hope it's the right one. We have so many. Yes. So to show you some variance in what the data analysis agent actually can derive from the get-go. And I think this is so powerful for anyone, any researcher ever using data, to see how cool these overviews of figures actually are from just one-shotted, basically. I think it's so good. You can see here is the one we actually had in the other run, piperacolic. But here actually it said, okay, listen, here's also butyric acid, which is also interesting to check out. And this is also the reason we do have, once again, another figure that was generated. And we do have like these curves, which I love because you can definitely see, sorry for me being very fast. If you have any scientific question, you can always reach out to us. We're happy to do more of a deep dive with any researcher. This is for piperacolic. If you're familiar with how these curves typically look, you'll definitely recognize that you should check those results out, or at least worth exploring further. And here was one of the caveats. So basically, it came to the conclusion that not only piperacolic is cool, because like was one of the reasons why the other agent stopped. It said, okay, it's the only one that is basically decreased both in fecal but serum as well before flares. So this is actually really good. But the other one said, okay, listen, but I found something, or this one said, okay, I found something that is increased in both fecal and serum. So it said, okay, hey, instead of saying I'll double down on this one, I'll actually explore this one as well. And in the end, this is also why it took longer, because you're now basically 2 steps, let's say, each for the candidates. And you end up with and I think this is actually really cool, with a dual panel. Because with biomarkers, you need to know, like, the more, if you have a panel that has for 2 metabolites that you test, 2 or 3, it's oftentimes more expensive, but it's easier to validate and stay true to what it actually should test. So having one single one would be good if it's like a high performing one. For every scientist, area under the curve, it's not the perfect one, but it's actually really, really good. And yes, I did a third one, but to be honest, we arrived at roughly the same thing. So I'll spare this one given the time. Sorry if I was too fast.
No, that was wonderful, Lucas. Thank you so much for the comprehensive overview. I wanted to maybe surface 2 interesting questions from the chat. The first one was, what are your sort of tips for the how to prompt BIOS effectively? Because, like, obviously without, I think this is where, like, I compare my outputs to yours and I'm like, wow, there's just levels to this. And secondly, from like a verifiability, from a confidence perspective, how do you sort of see the outputs of BIOS and like verify or potentially dispute in some cases the accuracy or legitimacy of either claims from the literature or even maybe data analysis claims?
Yeah. So on the prompting, I think it's a science of its own, to be completely honest. It takes some iterations to get it right and a lot of testing, but we actually supply good prompting examples, I think, in our documentation to check out. We'll definitely try to update this and make it more advanced for you to actually understand, like, I think we have good examples, because it always helps to, for example, have different goals that you make it really clear what you want to get out of your runs. So, for example, if you want to have good figures, please tell to make good figures. If you really want to ensure that it should be compared to, you do want to know what the average, for example, heart rate reduction is, you need to spell it out. So I think the more you spell out, the better your prompts are, and the better your output, or basically the results of the agent runs, will be. So I would rather be more specific and take more time to iterate on the prompting. You can even use AI to make your prompt better, instead of like just saying, hey, investigate whatever. Because, like, I think to be fair, I think with the autonomous mode, we do an incredibly good job with even bad prompts. But you will definitely have more fun if you do very good prompts from the get-go. And on the second part of the question, I'm, at least for what we try to do, so we tried also with BIOS to replicate some of the papers that were out there. I'm at least currently, I'm very confident that what we receive as output, especially when it's computational heavy, so coming from data analysis, that these results are to be trusted. We will for sure release, though, some deep dives where you can see why we think so. But as you think about, like, for example, some of these runs run 20 iterations, right? And for us, going through each of the iteration or reading 40 pages of summary and verifying each of the claims is, like, to be honest, as a scientist, really hard. But so far, I think I can speak for the both of you, both of us, Clara and myself. We are very confident in the outputs.
Yeah, definitely we'll have some more analysis on that later, but I just think even with what you've shown today, just being able to see with an identical prompt, we can already, and like a degree of autonomous mode, we can already see like variable amount of iterations. For example, I think one of them had 4 and the other one had 6. And these are, stochastic probabilistic systems. But even with a variable amount of thinking, they're converging to the same same outputs. So it suggests that there is probably something here. Of course, this is a claim that, you know, we will back up in the future from like a statistics perspective, but I think it's like currently looking very promising. And I would say for those in the chat that are kind of interested, definitely look at the right-hand panel, especially on the literature side. You will see these inline citations where papers are referenced for how the agent, how the AI scientist got to, how it got to these conclusions. And then also for the more like quantitative technical individuals, being able to inspect the Python notebooks on the data analysis side. If you're sort of not totally convinced of the results, you can always, you know, run one of these notebooks either locally, like in a Jupyter environment, or a Google Colab. Probably Google Colab would be the easiest one, but that's how you can sort of verify the legitimacy of what the agent is claiming. I guess I'll take just maybe one last question, and then we can wrap this up. How you compare to Edison Future House? Right now, I think like we're just sort of comparing based off of the Bixbench results. Edison and Future House have gotten done quite some wonderful work for the ecosystem. One thing that we're very curious about is I believe they've hinted that they're going to be releasing a literature sort of benchmark too. So once this comes out, we're definitely excited to compare against that. I think this is something where they're constantly pushing the envelope. They recently had an announcement where they expanded their data sources significantly. So yeah, definitely one area that we're continuously looking to improve. The corpus of scientific literature, whether published or unpublished, is constantly growing. Amazing. Does anybody have any final thoughts before we close? Okay. Just as a reminder for everyone, you can try BIOS out at chat.bio.xyz. If you are a researcher with a .edu email, you should sign up with that, and then you will have automatic researcher tier access, which is like a ton of compute. For those that aren't necessarily researchers, you do have free credits that you can use, and then choose based off of your usage how you want to continue. But we're really excited about the initial enthusiasm that we have seen in this chat on X. And if there are any other researchers, like, feel free to reach out to any of us. We're really trying to build the best AI for science here. Awesome. Thanks, everyone. Bye-bye.